Hi, I'm Kathleen Camerata. I'm a physical therapist with THA Group, and this is our good friend, Mr. William Davis, who resides at Riverside at Belfair. Mr. Davis, we'd like you to tell us a little bit about your story, about your childhood.
Well, what you asked the questions now. I answer.
Tell us about your struggles with polio when you were a child.
Well, I got it as a kid, about 11 years old. I was out of school for better part of a year, and it took a long time for me to learn to walk again. But bit by bit I got it back, and after all I served 4 years in the Navy, so it didn't bother me that much.
And tell us about when you grew up. You went to Villanova for a couple of years.
Well, I went to Villanova, and I went from there to the United States Merchant Marine Academy. That was the...
What year did you graduate from the academy?
1943.
Wow. And then...
A long time, huh?
It was. And then what happened after graduation?
Well, then I was commissioned in ensign, and I went down to South Pacific for a few more years.
Yes. Okay. So you served the United States government in the South Pacific. Thank you. Thank you for your service.
Oh, well, I didn't have much choice. But then I'll get drafted.
That's right.
Way away.
That's right. Okay. And then you came back and you had a pretty exciting life when you came back.
Well, yes, I guess. Just trying to stay alive and earn money. If you're not rich, you got to go out and work for it.
That's right. And Mr. Davis lived a life sort of like the show Mad Men. Tell us what you did on Madison Avenue.
Oh, I worked for a number of magazine publishers. Biggest one would be Look magazine. I worked with one other person. We handled the alcoholic beverage advertising in Look. And that was 4 or 5 years of that. Then I went into the newspaper business and worked there for 20 years.
Right.
In advertising. The area was known as the Magazine Publishers Group, and they were the biggest newspapers in the country, had a conglomeration, and they sold their Sunday magazine, which very much like This Week.
Right, right.
And you put them all together, and you can buy space in 1, 2, or 3, or 4, depending upon what you needed. But it was great penetration of the market, because everybody reads a Sunday magazine on Sunday. That's the day of repose.
That's right.
No problem. You're not traveling anywhere. It's a good vehicle.
So you had a really interesting life.
Oh, I'm still around.
And you are still around. And you're doing very well.
I'm breathing in and out. I'll never make Admiral.
When did you come to Riverside at Belfair?
When did you move into Riverside at Belfair?
Oh, I've been here, I guess now about three years.
I think you've been here longer. You and
well,
Emily.
The time flies by, I'm not sure.
I believe you and Emily were the first residents, weren't you?
We're among the first, yeah.
Mm-hmm. Yeah.
Yeah, I guess it was.
Right.
How long is that now?
Oh, my goodness.
I haven't the
I'd
foggiest
have to,
idea.
It's been a while.
Time goes quickly as you get older. You wish that you could stop it, but you can't.
That's what they
You're
say.
on a downhill slide.
Not you. Not you.
So did you come to physical therapy here at Riverside at Belfair? Have you worked with Kathleen as a patient of Kathleen's?
I guess I came here as I didn't know I was a patient, but I guess I'm a patient. I got hornswoggled into it.
Oh!
Your daughter Liz and I and your doctor, we're all in cahoots to make sure you stay stronger.
I don't know who's my doctor anymore.
Can you show us some of the things that you learned in physical therapy? What are some of the exercises you've done? Do you remember?
Most of them were on the machines.
Uh-huh.
The leg machine, pretty much.
Mm-hmm.
Which is adequate. Yeah, it's good.
Yep. And you're walking well.
Well, I'm making around, I'm 90 years old, so I'm not about to run in the Olympics.
That's hard to believe that you're 90 years old.
Good.
You don't know anybody as old as I am.
Well, we want to thank you for giving us your story. You really have had an amazing
I'm
life.
very happy to help you any way I can.
And you look like you're doing wonderful.
I'm breathing in and out. As I said, I'll never make Admiral.
Well, let's see you get up and show us how you're walking.
Thank you,
Okay, I
Mr.
don't need this.
Davis.
That's a pretty fast gait.
How's that?
That's great.
I don't want to fall down.
Oh no. Thank you, Mr. Davis.
Thank you, Mr. Davis.